Let's talk about STIs, specifically chlamydia. Chlamydia trachomatis is a sexually transmitted infection, or otherwise known as STI, and it's caused by bacteria that affects men and women in all age groups. Although there is a minority amount of people who actually experience symptoms, females often experience disordered bleeding, vaginal discharge, and painful intercourse, whereas males would experience painful ejaculation, penile discharge, and testicular swelling. When considering women's reproductive health, it is also important to think about cervicitis. So, that can mean emission and secretion of fluid containing mucus and pus, or to watch out for easily induced endocervical bleeding, which is bleeding not related to the menstrual cycle. Like I mentioned before, not a lot of people actually experience symptoms, with males only about 10% and a little bit more with females around 30% that actually experience the symptoms. When it comes to STIs, you should know if you should be screened. Both males and females should be screened if they're having multiple sex partners, but men who don't use a condom always or are engaging in sexual intercourse with other men, or women who are sexually active 25 or younger, or pregnant should be screened. To test for chlamydia, you could either get a swab of the discharge from the cervix, or inside the urethra, or sometimes anus for males. Otherwise, you can just get a urine test, depending on your medical professional. With the stigma surrounding STIs and STDs, it's important for people to know how to actually prevent them. So, one of the main uses of prevention is using a condom. Using it properly during every sexual encounter reduces but does not eliminate the risk of infection. It's also important to get regular screenings, like we talked about, limiting sexual partners, and for females to avoid douching because it decreases the number of good bacteria in the vagina, which can actually increase the risk of infection. STIs can seem scary, but with the right antibiotics, with a one-time dose, or a couple days of taking your medication daily, the infection should resolve within 1 to 2 weeks. During that time, you should abstain from sex, and your sexual partner should get tested. By getting the right treatment, you can prevent long-term effects such as ectopic pregnancy, infertility, pelvic inflammatory disease or PID, epididymitis, a prostate gland infection, or a newborn infection. Thank you for watching.